So we just concluded an episode of Coffee House where we featured the film Blue Eyeshadow, kind of opened up a conversation about AIDS and HIV, and of course with World AIDS Day coming, we want to continue that conversation now. Again, we're joined by Eddrick Jerome, the writer of the film. We're also joined by Keshia Lynch and Alton. They're healthcare professionals. They deal with awareness and treatment and care. Let me start the question with this. Obviously, December 1st, 1988, the first World AIDS Day. I got to ask you, 30 plus years later, where do you think the world needs to be as far as awareness? Have views changed? What do you think needs to be done?
The world needs to understand that AIDS and HIV is no longer perceived as the death sentence like it used to be when it first started. Years and years ago, when you hear those words, HIV, AIDS, you immediately thought that that person was going to be gone. And I think thousands of people are living healthy and prosperous lives with HIV. And I think that's a testament to the advancement of care delivery and things like what LifeLong is doing and bringing awareness and getting people the treatment that they need.
There still is a huge gap in education, and now with the advance of technology and medications, there's antiviral, retroviral drugs that will keep people stable at stable levels where they can become undetectable.
Has awareness fallen off? Are people thinking about other things? You guys are there on the front lines. Do you think that this is something that needs to still be pushed to people? Because I think people are kind of forgetting about it at some point, and I think we can't let that happen.
It is definitely a conversation that we still need to have in our schools and our healthcare systems, despite the advances that medication and treatment has had. One thing that we need to do a better job communicating is that HIV just doesn't impact the person living with the virus, but it impacts us all. The way that we can better heal and support patients is really coming together as a community, as a whole, and playing our roles to help each and every one of us deal with this epidemic.
You mentioned affects us all. I'm curious, of course, you're very passionate about what you do, healthcare, treatment, awareness. What is your connection to AIDS, professionally or personal, that kind of brought you to the field you're in today?
Absolutely. I have a very strong connection with HIV, AIDS. I have a couple of family members, older family members, that were diagnosed in the late 80s. That was never a topic of discussion when I grew up until I got into this field, actually, which is very common amongst communities of color. You kind of don't talk about some of these important issues. So I actually started my journey in this field about 7 years ago, working as an HIV case manager. And at that time, I was just fresh out of school. And going into HIV wasn't something at the forefront of my mind. I really just wanted to get into public health. And so it just so happens that the position that I first had in public health was an HIV case manager in a very rural county in Madera. And seeing the disparities, the stigma, and the fear amongst rural communities and communities of color in general really sparked a passion in me to continue this work 7 years later. It's work that I've done client level. It's work that I've also done on a more macro level at the state. It's work that I'm doing in a community level. I also volunteer for children living with HIV for Sunburst projects. So it's something that I'm very passionate about and committed to.
Eddrick, I know that you have a story as well.
Sure. For me, it's both personally and professionally. My late brother Eddie, we lost in 1995 to HIV and AIDS, and we were caregivers and provided care for him for about a year and a half. So it's personal to me in how it affects families and the loved ones that are lost. Professionally, I've just recently retired after a 30-year career in healthcare operations and clinical operations for Kaiser Permanente. So I'm well-versed. We work closely with our infectious disease departments, well-versed in care delivery, trying to address healthcare disparities, screenings, getting people the care they need. And so I guess I kind of have a foot in both camps. So it's a situation about continuing the awareness, as Keshia said, and having these conversations and ensuring that people have access to the resources and the preventive care that they need, which is also of a primary importance. And so I come at it from a couple of different perspectives.
For me, I think when I was growing up and finding my way and looking for community, I think like a lot of young gay people, just trying to find a space for where I belong. I was able to find community in San Francisco, where I grew up, and just volunteering with San Francisco Community Health Center, working with people, different generations, four generations of people in the queer community, where I found just great mentorship and, you know, some living with AIDS, many that have gone through the HIV epidemic. And I think I was just looking for community, and that's what I really found. And as I was growing and learning more about myself, I didn't really know what I wanted to do with my life professionally either. I was just working in retail, and through community, through health, I found myself, you know, gravitating towards, hey, I think I see myself helping people in health as the same way that they helped me. Because when I first went there, I just went there kind of like as a social community space, and they kind of blended in health as well. And I found that really powerful for me, because it just helped build my identity and where I wanted to go. So I went back to school. I wasn't going to school at the time. I went back to school with goals in mind, wanting to give back to my community that has given to me and helped me grow. And one day I would be able to do the same for someone like me.
You talk about wanting to help people. Of course, when you're talking about healthcare, a lot has changed. We kind of touched upon that earlier. How are approaches to care changed today? What do things look like?
Oh, yes. Approaches to care are completely different. And I know specifically at LifeLong, we really strive to reach patients at where they're at. And so in regards to treatment, you know, you have your antiretroviral therapy in pill form. Now there's injectables for patients to be able to choose, which is a great option for those that can't take pills or experience medication exhaustion. We also have a robust street team at LifeLong that cover 5 different zones throughout Alameda County. And they're actually going out to homeless encampments and providing the same quality of primary care as well as HIV specialty care in those fields where maybe patients don't have the transportation to come in clinic, or they're not ready to come in clinic yet. So technology, insights on structures and delivering healthcare have been carefully examined, and we've definitely challenged to go beyond kind of like institutionalized structures of providing care to really serve these vulnerable communities. And it's amazing, and we see great outcomes from it.
What's fantastic about what LifeLong's doing here, you said it, kind of taking the healthcare out of the clinic and away with the street team, which is an important aspect because there's challenges with kind of getting people to be screened regularly, right? And making people feel comfortable. And that dignity and that sensitivity is a big cornerstone about LifeLong's plan, right?
Absolutely. We definitely had to learn that we can't force people to adapt to kind of the same way of receiving healthcare, that we need to be the ones to adapt to them. And so it's phenomenal.
I think I mentioned earlier that I am the clinical supervisor at the Oakland LGBTQ Center's Glenberg Wellness Clinic. This is a recent partnership that just started within the year. And I think this was a really, really great step in partnering with a community center that's well known within the community in Oakland, and just trying to reach more patients and people that don't necessarily sometimes have access to care, and making it more accessible for them.
People come to you, you're kind of on the front lines and you see people. I'm always curious, what do you see in the faces out there? Because obviously when somebody feels like somebody's looking out for them, they're getting the care they need, that's got to be a reward in itself, of course, beyond helping someone. What's that like?
Having people come in is just build a sense of community around, if they're just coming here to be with community and be in a social circle, it's bridging that social and health aspect, because it is an important factor for many queer people that they're not necessarily comfortable sometimes going to their primary care. And this is a great space for queer people who maybe feel more comfortable in a community space, just going socially, and then they're like, hey, there's also a health center here. This is great. Somewhere I can get connected.
It's creating that safe space, I would think, where people feel valued and heard and respected, because you touched on it with primary care. At times there is that distinction of people don't want to feel judged, or they don't want to feel looked down upon. In healthcare outcomes are affected by how people feel about the quality of the care they receive. That's documented. And so having people feel valued and safe, I think, has a positive impact on care and how they receive their care and their outcomes.
For sure.
Absolutely. And I would say to take it a step further, there is a great feeling for the patient to be able to see peers on the front line providing those cares and being that extra level of support in addition to their medical team. In regards to peer support, whether it's just one-on-one counseling or support groups, or just having someone give you a text or check in on you to see how your personal well-being means so much to our patients. And I would say most of our patients at LifeLong, really anywhere, are doing well, right? Like they're doing well, they don't have too many social needs, but then there's always that small percentage that is really struggling, whether it's stigma, whether it's housing, whether it's substance abuse, or even denial. And so when you get a breakthrough with one of those patients where they've accepted that the care that the medical team is providing, or they've become virally suppressed after not taking their meds for 5+ years, those are really the rewarding moments, that like 1 to 5%. Those moments feel impactful. Those moments make this work rewarding, and it's a great feeling.
I've got to assume that that's not an easy thing to do, to break through to somebody and get them to know that. I mean, on a bigger sense, I'm always surprised that healthcare, which is so personal and so intimate, LifeLong's done something great here in kind of promoting that very sensitive care. Do you think that's something that maybe some people will see as an example and hopefully one day kind of adopt themselves? I mean, 40+ years LifeLong's been in the game.
And we are surrounded by other amazing organizations that we partner with as well. And so one thing that we want to make sure is that clients are receiving care at the best place. And if they decide not to receive it at LifeLong and receive it down the street, we definitely support them in that. We also really focus on healing. It's so important to provide care that is centered around healing, that is centered around cultural humility, that is centered around resilience and strength-based approaches. We strive to provide the best care that we can, both medically as well as social services, right? Because oftentimes the medical issue isn't even the main issue. It's other social factors that we need to take into account, and really looking at the person as a whole. If someone doesn't have a stable place to live, you're not going to get through to them about taking their medication. That's low on the priority list, right? Or if someone doesn't have the money to buy groceries, may not be able to take their meds. So we really try to create a comprehensive care plan. And instead of just kind of pushing the agenda of taking this medication to become virally suppressed, we really take the time to hear out what the patient's needs are immediately. And then we can work on developing a strong medical care plan when the rest of their needs are met.
And just to kind of clarify that, because obviously some people that may not be very well versed in some of the treatments now, virally suppressed, what does it actually do? And it's kind of not eliminating the virus, but sort of making sure that it doesn't kind of flare up and become dominant, correct?
Correct. That's absolutely correct. So clinically, viral suppression is considered a viral load count less than 200. And so that's kind of how we measure it.
I've heard kind of in conversations, just as we talk about some of the details, was the term PrEP navigator? Is that something that came? I just was curious for my own personal information. What is that? What does PrEP entail?
Yeah, I can speak on this. So prior to coming to the Oakland LGBTQ Center to be that bridge between the community center and LifeLong, I was doing PrEP navigation in Richmond. So PrEP is pre-exposure prophylaxis, and it's a drug that people can take to prevent the spread of HIV. It prevents HIV. It's highly effective by 99% when taken every day properly. Like Keshia was saying, connecting patients to whole person care is definitely something that was important, and PrEP navigation gave me the opportunity to just get to know patients and connect them to not only HIV prevention, but primary care as well. And if they needed housing support or transportation support, the HIV program within LifeLong had a way to help them.
Kind of tell me more about that and give me some details so people can understand what we're talking about.
Here at LifeLong, we have 2 PrEP navigators that can assist patients who are interested or who are determined to be a good fit for PrEP, help them navigate the healthcare system. So essentially being case managers for patients that are interested in this daily pill. There are several treatments that currently exist, and we are looking forward to the new treatment option, which is an injectable prescription for PrEP as another alternative to taking this medication. LifeLong has somewhere between 325 to 350 people on PrEP at any given time, and we are constantly finding ways to bring more awareness and education about PrEP, since oftentimes it may not be perceived as someone who needs PrEP or finds use of it. But it's definitely something that is helpful in assisting to help end the HIV epidemic. It's not going to be the sole end all, but it will help with those contributions. PrEP is for both men and women. We'd like to see more people on PrEP, especially those who may have frequently diagnosed with STIs or members of more vulnerable populations. So young gay men of color or same gender loving men, trans women, as well as Black and Latinx women as well. So it's just kind of one part in the kind of the scope of helping stopping the spread of HIV by empowering yourself to take control over your own health, and not having to rely on someone else to wear a condom, or if they're unaware of their own HIV status. It's a way to kind of just take control of your own health and just take a little bit of an extra step to protect yourself.
You know, when we talk about World AIDS Day coming, it's about awareness. It's about making sure the information's out there. Just kind of interesting, people may forget, at the time everything was happening back in the 80s, there was a lot of fear and a lot of misinformation. COVID comes along, right? A lot of similarities there. I mean, when you see that happening, does that kind of bring it to the forefront of, we got to kind of right the ship this time as well?
I think so. I think it's a situation where there are a lot of similarities between the initial wherewithal of HIV and AIDS and how people are reacting, and even with COVID today, with the way people and it's about information. You know, obviously, as information comes out, society reacts and people change and how they respond to situations. The question of COVID and HIV, I think they're interrelated. I do a podcast, and I had a chance to interview Steve Peters, who he was just depicted in the movie about Tammy Faye Baker. He was the one who was on her show and was the first openly gay man to be on a televangelist. So, well, I asked him that question about, you know, he's lived with HIV and AIDS for more than 30 years. And he said it was frightening in some aspects because of the extra precaution that someone with HIV and AIDS has to be aware of, especially in this COVID world. And there were definitely some changes to behavior in terms of group settings and social distancing and things that they have to be mindful of. We have to be mindful of with this population in this COVID world we're in. So it's definitely, I think, more information probably needs to be done. Research needs to be done about that, just how folks can navigate through this COVID world. But it is definitely an added barrier today, I think, for folks who are living with HIV and AIDS.
How can people kind of stay up to date on what's going on? Because, of course, in busy lives, people keep moving through and they may not know what resources they can look at. What should people really keep in mind as far as awareness, especially when December 1st is right around the corner?
That's one of the reasons why, and you know, I want to thank LifeLong Medical and KOFY for this forum. That's one of the reasons why we produced the film Blue Eyeshadow, is to try to continue that conversation and raise that awareness, and to remember those who have been lost to HIV and AIDS over the years. And so by having this event and having this conversation on World AIDS Day, I think is fantastic because, you know, it kind of brings it back home. And I think, you know, families are still grieving and will continue to grieve over the loss of talented and creative and funny and all the folks that we've lost over the years. So I think this is a great opportunity to rekindle in some respect. And I know the International AIDS Conference was scheduled for San Francisco last year, and obviously because of COVID, it didn't happen in a personal way or in person. But I think there's definitely an opportunity with things like LifeLong is doing to bring that awareness back to the forefront and to provide the sensitive and the care that folks need who are you know, obviously suffering with HIV and AIDS. For
World AIDS Day, I would say that something to keep in mind, making it a celebration of the people that have fought through this epidemic, that are thriving, that are healthy, that will live full lives, doing things that they love and enjoy. It's not a day that you need to mourn, but really just celebration, reaching out to someone that you may know living with HIV, and providing that extra level of support, initiating conversations with families is also a great way to commemorate getting tested, setting an example, or being the example, and showing friends and families that getting tested is important, and in knowing your status not just helps you, but your partners and the rest of the community. participating in activities that not just empower yourself, but so it's an example to empower other people. At LifeLong, you can definitely go on our website, lifelongmedical.org, and inquire about testing Ryan White services. We'll be testing at Steamworks, which is a local gay bathhouse, Gay Rico soon, which is a LGBTQ club. So we are constantly thinking of ways to reinvent ourselves and our approach to get the message out there, education, build community, and build support to those who may not want to or may not know of going into a clinic. We also provide in-home testing as well. So we can ship in-home HIV test kits to patients as well as STI kits. So people can test in the comfort of their own home. So we're always trying to think of ways and be innovative to reach people at where they're at, spread awareness, spread education the best way we can. And of course, with our partners, the Oakland LGBTQ Center, that's also another branch of us, which we really hope to reach young LGBTQ communities of color. So yes, many different ways, many different approaches, and we are very willing and welcoming here at LifeLong.
I'm always curious when you have a conversation, there's so many different avenues that you could go down. There's so many different things and details you could discuss. Is there anything that we haven't been talking about here that's always maybe overlooked, or something that you always want to reach out and say, why don't we ever get a chance to say this or talk about that? It's so important. Is there anything out there just kind of opening up the platform for sharing something that may not be at the forefront that we've overlooked?
Sure. I think just quickly to piggyback on something Keshia said, and also what Alton was talking about, is the emphasis on families and ensuring that as we have this conversation, typically in most cases, you're not just providing the care and the support for the individual, but also the family that surrounds that person. And so having that focus on including family and care delivery and strategy and planning, I think, is critical as you create your care plans for folks.
When you talk about the care of a patient, of course, there's many different needs, medical and dental, but mental is one that's very important that I think gets overlooked at sometimes. How does LifeLong approach that? What kind of programs and systems do they have in place?
HIV Care is just one of many, many programs and services that we provide here at LifeLong. And as I mentioned before, we have a number of case managers and PrEP navigators that, when working with a patient initially, identifies what additional needs they are, because it's important to look at the person as a whole and not just the virus. And so, as you mentioned, one thing that comes up quite frequently is behavioral health services. And LifeLong has a very robust behavioral health team that's located at each one of our clinics throughout Alameda, Contra Costa, and Marin County. And so it is very common that we make referrals to behavioral health by appointments, as well as on call. So our Trust Clinic, which primarily provides care to our homeless population, has behavioral health services that are same-day drop-ins, which has been very significant and impactful for that particular population. But mental health or behavioral health, in addition to housing support, has been tremendous social services that we provide at LifeLong.
You know, of course, I don't want to overshadow. We've been focusing on HIV and AIDS and World AIDS Day, but LifeLong has such a broad umbrella. Some of the other things, dental and the other outreach programs you have, do you want to mention some of those?
Yeah, so we have dental services that we refer patients to. We also, as I mentioned, have a robust street medicine team that goes out to homeless encampments and provides wound care, other comprehensive care, HIV care as well. And they're spread out all throughout Alameda County. We also have a Hep C program, MAT. We use opioids. We have primary care. We have several different types of case management. We also have a care at home program for patients that may not be physically able to come into the clinic. So we have designated medical providers and case managers that go out and provide care to a patient's home daily. So we have a number of services. We of course also have community outreach for diabetes, asthma. So the services that LifeLong provides is unmeasurable. And we also have our urgent care sites, which are tremendous for primary care, but also for the care of patients who may be newly diagnosed with HIV or don't like going to a primary care. So we drop in for STI services, which Alton mentioned a little bit earlier, that as a PrEP navigator, his role is to really not just link patients to PrEP or those newly diagnosed to HIV care, but also those also patients to primary care physicians. And so that has been very helpful for those patients that may frequent our urgent care. We also provide after-hour services. So outside of traditional 9 to 5, we provide care through urgent cares on the weekends and after hours to better accommodate to various schedules. Yes, we provide an array of services, and we serve such a large population of patients, from patients over the age of 50. I would say half of our patients. We serve somewhere around 250 to 300 patients living with HIV at LifeLong, and 50% of them are over the age of 50. So HIV and aging is something that comes up frequently. We provide care to youth. We provide care to the LGBTQ community, and trans care. Gender affirming care is also a really big focus that we have on our patients, as well as our LGBTQ community.
Of course, after World AIDS Day, we're going to be going into 2022. I know LifeLong has some new programs, some new testing sites. Can you tell me a little bit about those?
Yes, absolutely. We're really excited to ramp up our community outreach efforts. So beginning January 2022, we have a couple of new venues that will be doing rapid HIV and Hep C testing at. The first location is Steamworks, which is a gay male bathhouse that is located in Berkeley, not too far away from our LifeLong admin site, actually. And we will be there every second and fourth Saturday from 10 a.m. to 6 p.m. And so we're really excited about reaching the community. Steamworks has daily events for gay men. So we're really excited about providing education, testing, as well as promoting PrEP as prevention efforts. In addition to Steamworks, we will be partnering with K-Rico, which is an LGBTQ bar restaurant. And we really want to get a hold on the Latinx community, as we see new HIV cases rise amongst that population. So we've partnered with that with KRICO to conduct HIV testing as well as Hep C testing every first and third Saturday evenings from 9 to 11:30 at night.
Well, Keshia, Alton, Eddrick, thank you for joining us. We appreciate your time.
Brought to you by LifeLong Medical Care.